In the name of God, the most gracious, the most merciful. What is success in IVF and ICSI? It's a difficult question. However, we will address the three most important aspects in determining the real microscopic success according to science and international statistics. The first thing is pregnancy. Obviously, for all the couples who come to us, having a child is the most important thing for them. God willing, the couples will go home with a child. In the past, our real criterion was that a woman does the cycle all the time by transferring embryos, extracting the eggs, and transferring the embryos 2, 3, or 5 days later, which symbolizes a fresh pregnancy. No, the criterion for success now is cumulative pregnancy. Cumulative pregnancy means that we have optimal ovulation stimulation, so we still have numerous embryos. With good quality, as much as we can estimate, this invariably requires the reproductive stimulation to be with a consultant who has dedicated his life to the subject and knows the implications of getting the best from this ovary, and at the same time a good laboratory that will provide me with a good number of excellent embryos. Our objective is to have a number of good, excellent embryos. We will transfer the fresh ones and freeze the rest. If God blesses us with the fresh ones, these frozen embryos will remain for years. Maybe not really needed, but it's possible. Then we will return to freezing the frozen embryos after a simple preparation of the womb lining. That's the first scenario. If the woman is at risk of having a forced response, we will freeze all the embryos and leave the rest of the frozen embryos as they do in Europe and America. We will transfer 1 to 2 embryos. This time there will be a portion in the next and the next scenario. This is the cumulative pregnancy. And this is what we are supposed to use right from the beginning. And this is the basic pillar of the definition of success in IVF and ICSI, 1 and 2. The second criterion is safety for all. Safety for the mother and safety for the children. The safety for us is that we avoid problems such as imposing a response. It does happen and may lead the woman to interfere with her position or, God forbid, in some cases lead to death. Obviously, for us, this is the ultimate failure. Safety remains for the woman and for the children. We are doing the same as in the past, when we used to transfer 3 or 4 children. And officially, according to studies, pregnancy with 3 children first is a premature term. The premature explosion also affects the child's intelligence, so it goes against all safety standards, and it opposes me saying a word of success in high-quality microinjection. The laboratory maintains a very high level of quality, and on the basis that we remain in control of everything, and everything happens in the best possible way. The laboratory scenario is fully equipped to provide me with the highest chances of fertilization and the highest quality of embryos. We are now talking about something in our field called ignitics and genetics. The delay or the problem in the media and in this poor treatment can affect the children. After that, all laboratories have quality standards. The quality that should always be available is one of the basic pillars for the successful implementation of ICSI. The last important cornerstone is cost. Anything that I will provide to this couple must be proven to be useful. In our field, there is nothing more than the studies that come out every day that say such and such thing is important. And then when people start doing respectable studies that prove its futility, this is like the people who perform scenery before they first try to inject, without a doubt. Like people who do genetic testing of embryos for all cases, it's pointless. It does have a role. It's used in certain cases. Iris testing, which does something called irradiating, uses a tissue part of the womb lining, and we see the specific genes responsible for the embryo implantation. None of this has proven germination. The truth is that if I want to spend money, I should spend it on the basic media that I use to deal with embryos in a way that has proven its effectiveness. Not that I burden the couple with steps that have no benefit, and their effectiveness has not been proven. I don't want to increase their costs without any benefit. Hopefully, the second success will be complete. In short, cumulative pregnancy for everyone, and avoiding costs that have a womb schedule in place of knowledge.